Welcome to the program, everybody, from the edge of America. I'm Rick Amato. The politics on the Obamacare rollout have been polarizing and passionate, to say the least. We have some Democrats accusing Republicans of being racist and anarchist, and some Republicans accusing Democrats of being out to destroy America. Today, we want to try and push away the hyperbole and the polarizing politics and take a look at this serious topic, Obamacare, which represents 1/6 of the U.S. economy, but more importantly, directly affects the health and well-being of individual citizens across America. After all, even if you oppose the president's plan, you have to at least acknowledge that America is the only developed nation in the world that still does not provide direct health care access coverage to all its citizens. And that is something that should be a concern to all Americans, Democrats and Republicans alike. And even if you are a supporter of the president's health care plan, you have to at least acknowledge that the critics have some real legitimate points. And those points took on a whole new meaning this week when the California Medical Association announced that 70% of doctors here in California, that's a very liberal state we're in, that deeply blue state, California, 70% of doctors now say they will opt out and not participate in Obamacare. And remember, as oftentimes as California goes, so goes America. And that, too, is something that should be a concern to all Americans, Democrats, Republicans alike, inside and outside of California. Joining me at this time is someone who, along with her physician husband, owns a medical practice right here in California in which she acts as the business manager for the medical practice. Her name is Patty Newman. And at this time, I'd like to welcome Patty to the show. Patty, how you doing?
Good. How are you, Rick?
Doing good. So what is the number one reason that such a high number, 70% of doctors, don't just mildly oppose Obamacare here in California? They strongly oppose it. When they say they're going to opt out, that's a strong statement.
That is 70% of physicians, and I don't think this is a political issue, like you were saying. This is more of an economic issue. The reimbursement rates for California under the Medi-Cal program is the reimbursement that these physicians would be getting under the Obamacare plans.
So what does that mean to our viewers out there that are in New York or Texas or Florida?
Well, that means that when normally a physician would be getting perhaps $60, $63 per visit from a Medicare standpoint, when you turn it into the California care or, covered California reimbursement rate, that's $24 for a visit.
So it is a huge pay cut.
Yes.
For doctors, which is something serious.
Not only that, it comes with all kinds of strings attached.
Give you an example.
This program asks for physicians to spend a certain amount of time with the patients to explore all kinds of things that maybe a normal office visit wouldn't go into. You have to go back into social history, family history. You remember all those intrusive questions that have been in the news.
Right.
These are mandates. So all of the time that has to be spent, a physician's office is a business. You have to pay your staff. You have to pay unemployment insurance. You have to pay payroll, the physicians.
Yeah.
I mean,
yeah, it is a business.
So you cannot
It's not Christmas Day.
No, imagine $24 for a patient visit doesn't cover the expenses.
So when a doctor says that he or she will not participate in Obamacare, while at the same time it is the law of the land, explain to our viewers, what does that mean? How does one choose not to participate?
Well, let me tell you how it works. When you participate in a plan, you get a contract from the insurance company. Now, we thought, those of us that are in the industry in California, we thought it was kind of funny that back in January of 2013, we started receiving contracts for Obamacare plans without reimbursement stated in the contract. So most physicians went, oh, okay, that's kind of weird. Number one, that it came out so early, because normally it comes out about 90 days before a contract.
What business person in any walk of life signs a contract without the deals being
You
included.
would be surprised, though, because historically speaking, physicians are not great businessmen.
That's true. That's true.
So normally, in years past, and I've been in the industry for more than 2 decades, the physicians would just sign the dotted line.
Okay.
Because you expect, you had a certain
trust the
level of trust. That is gone. With all of this talk of Obamacare, the trust is gone. That is not the scariest part, by the way, that I have found in some of the new contracts, and then this one will spook you.
Let's hear it.
Some of the contracts say you have to give us access to your medical records within 30 days of signing the contract.
What are they trying to get at? What is the rationale behind that?
The rationale behind that is that they want to know what the patient's ailments are. They want to keep record of all of these.
Why?
Well, if you believe in...
We don't know is what the answer is, but go ahead.
No, I think we do.
Okay.
Eventually, a socialized healthcare system has to come in with some kind of limits for service. You've heard of IPAB, or the dreadful, death panels.
Right.
If you get everybody's healthcare history, then you have the data to say, well, you've been partying a little too much, you've been drinking a little too much. All of this data that's collected on a normal visit, you're trying to figure out why the patient's liver is not functioning well. Well, it turns out that he drinks every day. All of this data is being given to Health and Human Services. So when it comes time to limit your care, they will have the excuse to do it.
We had a doctor on earlier this week, her name escapes me at the moment, from Atlanta, Georgia, an African-American woman, Dr. Atlanta George. She said that she will not participate in Obamacare. She said she will retire from medicine if she's required to participate. And one of her number one concerns is that Obamacare puts the government in between the patient and the doctor relationship. That is something that those who support Obamacare say is right-wing hysteria. Give us an example of the government getting in between.
Well, that example of the medical records,
that's what I thought of that.
The NRA had a victory when they actually pushed back on having doctors ask for whether a patient owned a gun or not. This is the most trusted relationship a person can have other than their spouse. And maybe sometimes they tell the doctor more things than they tell their spouse.
Sure.
You're going to have the federal government in between that relationship. Now you know how the federal government uses our privacy, right? We've heard of what they've done with our privacy. They're going to have all these records and come in between. Now patients don't even know what to tell.
You laid out very well, and I thank you for that. I think you laid out very clearly for our viewers. Are there any other nations around the world who provide greater coverage for their citizens where the government does not play such an intrusive role, get in between the doctor and the patient, as you described?
No, there is no socialized program out there where the government is not involved. You cannot separate them. If it's a private industry, and let's say the physician's a private physician, he is the one that holds your records, right? If there's a breach of the records, guess who the patient can come after? They can go directly to the doctor and go, number one, I'll sue you for it. Number two, I'll tell everybody and their sister that you did that. You have now the government in the middle of this. Who's the patient going to retaliate against? How are they going to be protecting their information if the government's in the middle? Now you can't go after the doctor because the government forced the doctor to give the data. And they can use them however they want. One of the things that really annoys me about people that are on the left side of things, and I know you don't want to get political with it, but you have to at a certain point, is that how can you be so arrogant to think that the next administration may not be a right-wing administration, and they too may want to use your data? That's right.
Hey, listen, we see that. I see that. That's the same argument I make when it comes to the IRS targeting Tea Party groups.
Exactly.
And what makes them so arrogant, as you say, to think that the tables won't be turned someday?
I think so. I think that this is an American issue. It's not a right or left. You are so right when you said that at the beginning.
Is there a solution? The Republicans get criticized for not putting a solution out. We're down to a minute. We have another segment coming up. But is there a solution to getting coverage to more people who are at a bottom rung, economically speaking, or have pre-existing conditions without compromising government intervention?
Well, I would like the government to be completely out of it. That would be a first step on the solution.
I phrased it the wrong way. Without compromising the privacy with government intervention.
The more you inject private principles of the free market into a healthcare system, the more it will be better for everybody. Why? If you just did a copay, a minor copay, let's say a $5 copay on state-sponsored plans like Medi-Cal in California or Medicaid across the states, across the nation. That would save so much money because it puts the patient's skin in the game, and they decide whether or not they're going to show up to their doctor's office to be treated for a bee sting.
Right.
Instead, they're going to go, well, that's going to cost me $5. I think I'm just going to deal with it. Healthcare costs would just plummet if you just put that little bit of it. Yes, because it's your money. You don't want to put in the $5. You have to pay the $5 in advance to see a doctor. When you just give free rein and give it for free for everyone, then the system collapses.
All right, stay with us. So we've heard from Patty Newman here. Her and her husband own a medical practice here in Southern California. We heard why 70% of the doctors across California oppose the new health care law. I emphasize, this is liberal California. On the other side of this break, she'll stay with us. On the other side of this break, we'll be joined by someone who is an outspoken supporter of Obamacare. We'll get that side of the story and his view on what those in a medical profession are saying. They have to be concerned that people like yourself and your husband and others feel the way you feel. Don't go anywhere. That's what's next.
Affordable, quality, accessible health care for all Americans. It's about choice. If you like what you have and you want to keep it, you have the choice to do that.
All right, that was then Speaker of the House and Obamacare architect Nancy Pelosi in June of 2009. All right, as we pointed out at the start of the show, 70% of California's doctors say they will not participate in Obamacare. All Americans should be concerned about that, inside, outside of California, regardless if you're a Republican or a Democrat. I'm joined by both Jan Ronas, a legal analyst and outspoken supporter of Obamacare, and Patty Newman continues to join us from the first segment. She, along with her husband, own a medical practice here in California. Jan, welcome to the show.
Good afternoon.
Let's start with why is it that conceptually you support the Affordable Care Act?
Well, the primary reason is the system that we had before the Affordable Care Act was implemented was a disaster. I mean, essentially it was costing the government more money because those people who weren't insured, first of all, millions of people were uninsured. That's a tragedy in America that many people not have insurance. Secondly, the people that did have insurance were using the emergency rooms around this country and hospitals as doctors' offices, costing the government, hundreds of millions, if not billions of dollars unnecessarily.
I don't want to put words in your mouth. Sure. So is it fair to say it's not that you really support Obamacare, you support an alternative that was better to the system we had? Well,
no, I do support Obamacare because, among other things, it's going to, for example, people who otherwise were uninsured because they had pre-existing conditions and couldn't get insurance and lived in fear of getting sick are now able to get insurance. People who otherwise couldn't get insurance because they couldn't afford it through subsidies and things of that nature can get insurance. And so it's a wonderful program. I mean, it's having the same kind of rollout as Medicare did, in the sense that everybody's opposed to it. Doctors are saying they're not going to, provide services under Obamacare. I just don't believe that. It's going to be a successful program.
Well, that's interesting. And Patty, you and your husband own a medical practice, as we pointed out. You are the business manager. He says, Jan says that, yeah, we've seen this before.
Right. Well, part of the facts that he brought out, I don't agree with.
Tell us what.
85% of Americans were happy with their insurance plan. Now, I understand there were a lot of people that were uninsured. However, some of them were uninsured by choice, as I was when I was young, because I would rather start my new business than spend all this money on health care when I could just go see the doctor and pay a fee for an office visit
so let's say instead of
that.
15% is 12%. I don't know. I'm throwing a number out there.
Right. And then if you do have a problem with the pre-existing condition clause, which I had a problem with, you don't just wreck the whole system to fix issues here and there. If you, like I said earlier today, if you inject free market principles, if you allow people to buy insurance across state borders, if you fix the problems, not just turn the whole industry upside down, and then on top of that, get intrusive in that relationship between the patient and the physician.
Right.
I mean, there are fixes for this that don't involve the whole system being rearranged.
Jan, when you say we saw this before, the doctors threatening to not participate, this is California, which we all know is a very blue state, a very liberal state. 70% of doctors say they'll take about a 2/3 pay cut.
Yeah. Well, first of all, I'm not so sure that statistic is accurate. I don't know who conducted the poll.
California Medical Association came out this week, the president, and announced
Okay.
that.
Well, I'm not so sure. Again, like many things, statistics can prove all kinds of different points. I'm not so sure that's a valid statistic. And doctors, this
Let's
wasn't...
call it 60.
Yeah,
Let's call it 60%.
Okay. This was not a program designed to benefit doctors in some economic way. If it's a byproduct of Obamacare, doctors can make money off of it, great, just like they have under Medicare. But this was a program designed to ensure all Americans, to make sure all Americans had access to affordable health care, and that people who had pre-existing conditions could no longer be denied coverage by insurance companies. They had all kinds of reasons. It wasn't all about doctors.
If I hear you correctly, you don't even want to acknowledge the fact that the overwhelming number of doctors, according to the CMA, have deep concerns.
Well, I'm sure they have deep concerns because it's an economic issue. And it's an issue.
And what's wrong with that?
There's nothing wrong with somebody trying to, for example, fed their own nest, protect their economic interests. That's certainly a common reaction. But it wasn't just about doctors. Again, it was designed as a program to extend the coverage to tens of millions of Americans who otherwise didn't have coverage.
I've known people that were considering medical school in Europe, chose not to go there because of the cost involved versus the compensation afterwards, and were considering, how can I get into medical school in America and practice here as opposed to Europe, where the compensation rewards me for my hard work. So I am really, really hesitant to downplay the financial impact here. But Patty, I know you want to say something.
I know, I'm just dying to say something. We're going to have a lot of people insured. And this has already started happening, where you have a lot of people with a shiny new insurance card. However, they will have no access to care because the physicians, at least the colleagues that we know, and yesterday, in fact, I called an independent insurance broker to get the data from them. It is true. The networks are very slim. Originally, the networks became slim because the insurance companies, in an attempt to save money, started shrinking the physician networks. Blue Shield now calls their PPO, their preferred provider organization, an EPO, an exclusive provider organization. Yeah, exclusive. They're trying to sell it that way. Exclusive meaning instead of having 10 doctors, they'll have 2. That's not exclusive. That's shrinking.
Now, we just heard Jan. I pointed out that he's really not taking it all that serious, that docs will take a cut in pay or some sort of lack of economic benefit. Mm-hmm. Likewise, am I wrong? I don't want to put words in your mouth. Mm-hmm. I get the sense that you think he's overplaying the card that the number of uninsured Americans and those with pre-existing disabilities is not the issue that you think.
I don't think it's the issue. Well, the premise is all wrong, that the federal government should be involved in health care, because you should worry about the time when the federal government says everybody has a right to an attorney. Actually, they already do, right? Miranda rights.
Of course they do.
And then sometimes that will evolve like it has with medicine, where the federal government would tell you, well, you can only charge so much. This is your allowable amount. This is what they tell physicians. So now you will become the next target when the federal government tells you what your allowed amount is for your services.
And that's
Because
a concern of docs.
everybody has
We're about out of time, Jan. I got to leave it right
Okay.
there. And I want to thank both of you. From where I am, I am concerned about those with pre-existing conditions not having the coverage that they've had. I am concerned about that 15% number of uninsured, those that have not chosen to be uninsured. But I am also very concerned about the government getting involved in the doc-patient relationship, and I'm concerned about what should be the most, the brightest in our society getting economically whopped over the head because the government says so. Anyway,
Absolutely.
maybe we'll continue some other time because we're going to have to, somewhere, hopefully there's a solution there.
Thank you so much.
You got it. It's time for our person of the day. Hopefully two of you can stay with us through this real quickly here. As we said, now it's time for a person